Hey, it's Shelby from Turn Sounds. The dot over a lowercase I or J is called a tittle.
Hey, I'm Abby, a clinical nutritionist.
And I'm Shelby, a clinical exercise physiologist, and this is the Move Your Mind podcast.
We are sick and tired of people being led astray by false information about diet and exercise.
So join us as we discuss common misconceptions about food and fitness with the latest scientific research.
Let's get into it.
Hello.
Hi.
Welcome.
Hi.
Yay, we have a third voice joining us today. We have Renee, a physio, joining us today, which is very, very, very exciting.
Yes, a new perspective.
Yes.
I'm very excited for some more brains to join us.
We were already talking before the episode and we're all so pumped and excited. It's very, very cool. So Renee, I'll let you introduce yourself a little bit, what you do, what you're interested in, and maybe a bit of what we're going to talk about today.
Yeah, sure. So as Shelby said, I am a physiotherapist, but I have a bit of a special interest in pelvic health, or more commonly known as women's health. And I'm currently studying a master's in clinical physiotherapy, specializing in continence and pelvic health.
So beautiful.
Yes, a bit of a lengthy title though.
So cool.
Yeah, all the abbreviations to cut that down is going to be fun.
No, exactly. But for those who haven't heard of pelvic health physiotherapy, we help with many different things. So we help with pelvic pain, painful sex, incontinence issues, so things like bladder leakage or inability to control bowel movements. And we also work with women throughout their pregnancies and afterwards as well to help treat any complications and help them participate safely in exercise. And we also work with men and children.
I was going to
ask,
you said women's health, so does that mean women, or do you work with other populations too?
We can work with other populations as well, but I would say women's health is more common just because women have babies, so dysfunction is more likely.
Talking about, yeah, I know. Speaking
So
about,
good.
actually, something no one knows yet is I'm pregnant. Congratulations! Thank you.
So exciting!
I know.
That's
No
a lie
one-
because I knew.
Abby knows. The podcast didn't know yet, so hello everyone. I'm 12 weeks pregnant.
Oh, did you do that on purpose?
Yes.
I'd have a really good reaction.
It's for the world to hear.
Because Renee is known for ages that I was trying. So yeah, I'm excited.
Yeah.
Anyway, I can come see you now.
I'm excited too.
So good.
Anyway, cool. That's how
We're going to have the
I got really
first
nervous.
Move Your Mind baby.
Yeah, the Move Your Mind baby.
Yes. Woo.
Amazing. We're all very excited. Great, cool. Thank you. That's out. You know, very good. We can talk more about later. All good?
Yes.
Brilliant. So through pregnancy, through, you said, like painful sex, things like problems urinating. Cool.
Mhm.
Nice. Lovely. I bet that's a fun study course for you. What does your course look like?
It's eye-opening, we'll
Mhm.
put it that way.
Mhm.
I really enjoy it, but you definitely have to go in with an open mind. We actually practice everything on each other, which I guess makes us quite unique as professionals. So we do a lot of work with internal examinations of the pelvic floor and things like that.
Mhm.
Oh,
Um,
wow.
Yes.
Didn't even think about that.
Yeah.
Yeah.
It's
Wow.
like this deep dive into physio that you just don't really know about.
Yeah, exactly. And so that's can be a little bit intimidating at first, learning that on each other. But one of my tutors said it gives you the ability to really empathize with your patients because you know exactly how they feel when you're doing these assessments on them, which kind of separates us from doctors and other professionals who only learn on their patients. They
Fair.
don't know what it actually feels like.
Yep.
So,
Cool. That's really fair, actually. That
Yeah.
makes a lot of sense.
yeah.
Nice. I like it. Well done. Good. Proud of you.
Thank you.
So, main topics of today's episode. What did you want to let everyone know about?
So, main topic today is the pelvic floor. So, I guess that's at the crux of everything pelvic health is the pelvic floor. The pelvic floor is always related in some way. So, we're going to do a really, really brief introduction of the anatomy, the function, what you might notice if things are going wrong or if your pelvic floor aren't functioning, exactly the way we want them to. So, yeah, that's what we're going to be going into today.
Nice.
I feel like as a Pilates instructor, I hear a lot of clients or the word pelvic floor is thrown around a lot and people aren't really aware of what it exactly is. It's like, oh, my pelvic floor or this is my pelvic floor. And it's like, it's hard. Even in myself, it took me a while to be able to kind of contract or control mine. And that was after years of practicing Pilates.
Yeah,
So
I
I'm
know I'm
excited
not
to
amazing
learn
at
more
it.
about it. Yeah.
Yeah, no, exactly. I think everyone has that kind of very general, vague knowledge of where
Yeah.
it is, but that's where it stops. for
Well,
most
even
people.
where I'm currently working, one day I was like, and what do you guys know about your pelvic floor? And they were like, it was like crickets. And I was like, guys, have you heard of your pelvic floor? And some of the ladies were like,
The thing that if it's weak, it makes you wee when you jump.
Yeah.
Like that's about what I've heard.
and I was like, fantastic. But fun. We so I started studying physio at uni. I did a couple of years, and we had ultrasound in our women's health, and I was picked for whatever reason, and she was like, and contract and relax, and nothing happened. It just stayed all contracted. So relax, and I was like, I think I did. No, you didn't. And then she's like, lift, and it all squeezed together, and I was like, oh no.
That's a topic in itself, isn't it? Like usually it'd be
yes.
like weak pelvic floor is the issue,
Oh,
but like
yeah.
overactive is also a problem.
Yeah, absolutely.
And
Yeah.
we'll touch on that,
Yeah.
but yes, it is a
Cool.
whole topic in itself.
Yeah.
What is your pelvic floor, Renee, please?
All right, so most people have heard of their pelvic floor muscles, but the pelvic floor itself is made up of more than just muscles. So it's made up of nerves, blood vessels, and connective tissue as well.
I'd never even considered that.
Yeah.
That's fair. Yeah.
So there's definitely more than the muscles in there, but the reason we focus on the muscles is they're the one part that we can actually control, or the one part we can actually change, I guess. The other stuff.
Voluntarily,
Yeah,
yeah.
exactly.
Yeah.
So in terms of pelvic floor muscles then, talking about something that we actually have control over, so pelvic floor, there are multiple muscles. So it's not just a big muscle, which I think sometimes people get confused with, but muscles plural, there is a few of them. And they all have slightly different functions. So just kind of a brief overview. So you have your circular, we call them sphincter muscles around your front passage, so your urethra, where your wee comes out of, and also these same muscles around your back passage. So some of these you have voluntary control over. So you can voluntarily squeeze these to stop you from going to the toilet when you don't want to, or if it's not the right time to go to the toilet.
Yeah.
And then you can also voluntarily relax them when you need to go to the toilet.
Because I've heard, contracting your pelvic floor, it's like trying to stop pee and poo at the same time.
Yeah.
It's a very common cue, isn't it?
Yeah, exactly. So other muscles, we've got your more superficial muscles, so the outside muscles around your vagina. These have more of a role in sexual function and pleasure.
Mm-hmm.
And then I guess our kind of third group are the deeper layer. So they are the ones that form a hammock or a sling. So these are the ones that most people have heard of. So we explain these ones as going from your pubic bone at the front to your coccyx at the back. And these act as more of a support or a sling for your pelvic organs and hold them up where they're supposed to be. So you've got your bladder, your uterus in women, and your bowel. So those deeper muscles support all of those pelvic organs.
Hold them all up.
Yeah. Is it like the
Coming out.
TA of the pelvic region? That's what I'm thinking. Like transverse, like all the wrapping around, and then like the rectus versus the.
Yeah.
No,
Yeah.
maybe. That's
Well,
what
I
I'm
guess in
thinking.
the way that the TA is the deeper abdominal muscle and that kind of group of pelvic floor.
And they kind of
Yeah.
work to
Deeper.
like the sling or the lifting
Oh,
or the.
Yeah.
Ah, okay. See, my non-physio brain is like, this is how I get this information in.
Cool.
Yeah. So we touched on this briefly before, but these muscles are what we call skeletal muscles. So they're voluntary. So just like your glutes or your biceps or your hamstrings, we can voluntarily contract them.
Yeah.
But they can also get injured, just like any other muscle in your body. They can get weak, like any other muscle in your body, and they can also get tight. So that kind of goes into the overactive pelvic floor we mentioned before. So they are just like
Just
any other
must they
muscle,
react
but they're
just
in
the
a different
same.
spot.
Yeah, that's such a concept. Like, I wouldn't even think that they could get injured. Like, wow. Okay.
That's
I like
fair,
this.
isn't it? Yeah.
Yeah, and when we talk about injury, generally it's more on the side of childbirth. So with
Trauma.
perineal,
Yeah.
with trauma, perineal tearing, you can get little tears in the muscle, just like you can tear your calf muscle. So yeah, very
Yeah.
similar.
Mm-hmm.
Yeah.
I like it. Sounds good.
All right, should we go into the function?
Go for it. What do we need it for?
So we touched on this briefly when we were talking about the anatomy, but I guess three main functions we'll say. So They give us continence. So like we said before, stop you from going to the toilet when you don't want to, allow you
Brilliant.
to go to the toilet.
I love that function.
Very important.
Very necessary. Very grateful for that.
And they have a role in sexual function and orgasm. So also very important.
Yes.
Yes.
Not something we've really ever talked about on this
No, this
podcast
is-
before, but
yeah.
I'm definitely open to it.
Yeah. I find that kind of area of pelvic health physiotherapy super interesting.
Yeah.
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 I think it's something that there's probably still a bit of, I don't know if stigma is the right word.
Yeah, I was just thinking that in my head.
Yeah,
Like,
like
it's a bit
talking about
taboo.
it.
Like,
Yeah.
oh.
But, you know, sex is supposed to feel good. It's not supposed to hurt. So that is definitely part of our role as well. But again, a whole nother topic.
Already an important takeaway if anyone's listening there. Like,
Yeah.
things should feel nice. So don't
Exactly.
let it go on too long not feeling nice.
Yeah.
I've had
Yeah.
so many chats with friends that they think it's normal for it to be
Oh,
painful. And I'm like,
no.
that breaks my
that's
heart.
your body
No.
saying
Go see
something.
Renee.
Like,
Yeah. Come and see me, I can help. And that final function is, again, that support of the pelvic organ. So this is what prevents prolapse. So prolapse is that descent or that dropping down of your pelvic organs, or they're sitting lower than they normally would. So it helps to prevent that as well.
Mhm.
Yeah.
What issues do we have if your organs are sitting lower than they need to?
So what you might notice is feelings of heaviness, or that feeling of kind of bearing down on your pelvic floor.
I've heard people use those words before.
Yeah. Physically, what you might notice is like a lump or a bulge at the entrance of your vagina. So they're kind of what you would notice yourself.
Mhm.
But I guess more than anything, it can be uncomfortable.
Yeah, okay. Yeah.
Yeah.
Does it affect the function of the organs?
Not necessarily the
Like they're not on
organs.
tension or anything?
No,
Yeah,
no.
Yeah.
But it can have many impacts in other ways. So it can give you issues with, you know, releasing your bladder completely. Sometimes you can hold in your wee instead of, you know, letting it all out at once.
Then I think like infection, like urinary infections.
Oh,
and
like
stuff.
Yeah, urinary retention.
Yeah.
And then as well, it can make sex uncomfortable because if you have that dropping down of your organs into the vaginal canal, it can create
Stuff in the way.
stuff in the way. Exactly, that's the best way to explain it. Stuff in the way.
Stuff in the way. I actually have a question. So, like, when I have my period, so in the menstrual phase, I feel like, and I've heard a lot of people say it too, I know my mum suffers with it, like the heaviness. You're like, I feel like something's about to fall out. Does something go on with hormones during the menstrual phase which kind of increases chance of...
Yes, I've heard this
drop?
too. And I would say in someone young and healthy like yourself, there would actually be no physical dropping of the pelvic organs.
Yeah.
But we know that hormones have a big impact on muscle
Yeah.
and our pelvic floor muscles in particular. So those hormones can make our muscles more stretchy, I guess, and the ligaments and the connective tissue more stretchy.
like the laxity.
Yeah.
Yeah, okay.
Yeah.
Yeah, that makes sense.
So that heaviness would, I think, feel a little bit more like palpable because you could feel the.
Not like an
The
actual
stretch.
clinical issue, but it's just a change, I guess. And that's how I feel. Like, it's not an issue, but I'm like, I'm
Yeah.
aware of something.
Yeah.
Like, something's happening.
Just like we've talked about, like injury risks surrounding your menstrual cycle because things are a little bit
Yeah.
more stretchy.
Yes.
Yeah.
So
Yeah.
Yeah,
same
exactly
way.
the
Yeah.
same. So that may be what you're feeling.
Yeah.
But again, it can be something to be discussed at another time. Because I've had
Yeah.
a few people come to me and say that they haven't had any continence issues other than when they are on their period. So this is generally in older women or
Yeah.
like post or kind of during menopause, I guess. But yeah, I've definitely heard of it before. So something to look into for sure.
Absolutely.
Yeah, interesting.
Good,
Yeah.
I'll tell my mum. Be like, it's okay, mum. You're fine.
We're not going to die.
We'll be okay.
So go on anatomy, function. We covered the 3 functions.
Yes.
Amazing. What's next?
What's next?
So I wanted to go into what you might notice if your pelvic floor is not functioning at its best. I think this is super important because like we were saying before, a lot of the time, and especially as women, we kind of have these things that we've had for such a long time and we've accepted them as normal. And when you don't know what is not normal, you can't seek help for it, right?
If you're not talking about it and you don't know that no one else is feeling this,
Yeah.
you wouldn't know.
And one of my favorite sayings is, just because it is common doesn't mean that it is normal.
Completely.
Yes. Yeah, I like
and I
that a
think
lot.
there's so much, especially with female reproductive health, like period pain and all of that. Just because it's common, it doesn't mean it has to be like that.
Oh, another one for another time.
Yeah. Oh, cool. I like this.
Brilliant. This is going to be a whole series. I'm so excited.
So what you might notice if your pelvic floor is not functioning correctly. So leakage, when you cough, sneeze, laugh, jump, lift heavy weights, it can be a whole bunch of things, but usually it'll be a task where you have like that increase in tummy pressure. So you're working really hard or you're bracing to do that task. So normally this is because your pelvic floor aren't quite strong enough to counteract those increases in the pressure in your tummy. Or they aren't automatically lifting before you do those tasks. So you get a little bit of leakage.
So like a
lot.
motor patterning type
Yeah.
thing, like the order isn't happening
Yes.
properly.
Exactly. So I explain it as more of a coordination issue than a strength issue.
Yeah,
that
that's
makes
fair.
sense.
Yeah, if you don't know how to use a muscle, it doesn't matter how strong it is. If it doesn't come on,
Yeah,
when
if
it's
you can't
supposed
switch
to.
it on.
Yeah.
It's not going to do
Exactly.
anything.
Yeah.
So other things, you might not be able to hold on to your number ones or twos for very long. You might need to rush to get to the toilet in time, or you may have an accident on the way there.
Yeah. So like a feeling of urgency, is that what that's called?
So we call that urgency, and it can be both urinary urgency or fecal urgency. So both number ones, both number twos, so front and back passage. And we touched on this before, but a feeling of heaviness or that bearing down feeling in the pelvic region, or noticing that lump or that bulge at the entrance of the vagina. So again, this can be really common and is generally a sign, not always, but can be a sign that you have a prolapse going on. But generally this is more common in people who have had children or are in the older, I guess, generation. Risk increases with more children, and a whole bunch of things related to childbirth as well that we won't go into, and also increasing age.
Yeah, I have a client at the gym who I don't see very often, but sometimes do. And heavy squats. If the weight goes up, her range decreases because she doesn't feel comfortable squatting deep and heavy because of that feeling of heaviness and
pushing down on her pelvic floor.
Absolutely, yeah.
So I guess what I would say to her is, first of all, see your local pelvic health physiotherapist because it can be an indication that something else is going on, and you just want to make sure that you rule that out.
Absolutely.
But generally that is because your pelvic floor can't, like we were talking about before, counteract that pressure. So when you're doing a squat, what happens is that you have increased intra-abdominal pressure. So the pressure inside your abdomen increases underneath that weight. And then that pressure is pushing down onto your pelvic floor. Well, everywhere, but your pelvic floor is kind of at the bottom of your torso, I guess. And if you're not counteracting that pressure with a strong pelvic floor or a lift, then it can feel like it's actually pushing down onto it.
It feels like a weak link in the cylinder of your torso.
Yeah, exactly. Think about it like a cylinder.
Yeah.
Is that why some, or quite a few weightlifters, like heavy lifters, wear those belts? Is that anything to do with pelvic floor? Like it kind of contracts the lower region so there's less pressure?
It helps increase intra-abdominal pressure because you can brace out against it. So maybe not quite. Because I know that's why people wear them, so that they have something better to like push out
to
against.
brace against. It's not like a mechanical lift. It's like a...
it's not holding anything in, it's giving you something to like
push against.
Press against. That's my understanding of it at least,
Yeah, I actually don't know what it would do with your pelvic floor. Never really thought about that.
Just next time I see someone at the gym, I'll be like, is that to stop you from weeing your pants? I won't do that.
More likely it's something like, no, my back hurts if I don't wear this.
Exactly.
And it's not appropriately managed and they use it as a Band-Aid and they don't lift. That's not good when if you can't lift without your belt.
There's
something,
something going on that you need to work on.
But ask them. I would love for you to ask them.
Let us know what they say.
I'm not that gay.
Because usually it's like massive men wearing them.
People that lift heavy at the gym scare me enough. I won't walk too close. Just do my own thing.
Fabulous.
So another dysfunction that we can get is pelvic pain or pain with sex. So this can indicate that rather than the muscles not being strong, it's usually more so that they are actually tight and overactive and they can't be relaxed effectively. So this is super common in women with underlying conditions such as endometriosis.
Right.
Yeah.
Okay.
Right.
I think it's on our list of things to cover is
Yeah,
endometriosis, PCOS. So maybe we'll have you on for that as well.
Yeah.
We want to cover it from a nutrition and exercise point of view. And now we have an extra
Another
in-depth
point of
knowledge
view.
of it. Yeah. And we
Yes.
can look at it from that point of view too. That'd be
Yeah.
great.
And
Yeah.
And that's
Excellent.
like a diagnostic question that I would ask, like, do you have pain during sex? And that's just kind of like, oh, there's something going on like reproductive organs.
Yeah.
Does that make sense?
Yep. And so generally this creates pain and difficulty with penetration. So you can imagine if the muscles surrounding the vagina are tight and not relaxing, it's going to create more resistance, which for the woman will not feel very nice.
Yeah. Yeah.
Yeah. So I actually explain this as similar to when people hold a lot of tension in their neck. So I think we've all had neck pain at least once in our life.
Every day.
Yeah. So we all know that feeling. We're sitting down at a computer for a really long time and you get up and your neck feels really stiff and it feels really tight, and then we can sometimes get headaches as a result of this.
Yeah.
So just like your neck muscles, your pelvic floor muscles, just the same. So it can be really similar. So if you're stressed or if you have pain from a condition such as endometriosis, that pain can create that kind of guarding effect of the muscles.
Absolutely.
Or even stress and anxiety. There's a big link with overactivity in pelvic floor muscles as well. So just like you hold those tension positions in your neck when you're stressed, we as women can hold a lot of tension in our pelvic floor when we're stressed.
Yeah, that's fair.
That's so interesting.
And then add to the stress when everything's painful.
Yeah.
And it just kind of goes around and
Exactly.
around and around.
One thing on top of the other.
Yeah.
Yeah.
Oh, fun. We're going to cover at the end, I believe, things we can do to help. It's not just all doom and gloom.
Yes.
We're going to go over why
And that's
you
your
should
job,
see
isn't it? That's why you're studying, because there are stuff you can do to help.
You don't need to live like this.
So what I really wanted to touch on as well is who can this happen to? So again, there's kind of that preconceived idea that this just happens to women, you know, after they have a baby, they cough and sneeze and they have leakage, or when you get old. But that's not true. So anyone of any age, and not just ladies or women, and it's not just weakness and leakage as well. So we need to look at it, in a bigger picture.
Yeah, more of a
guess.
holistic view, maybe.
Oh, yes,
we love
love
that
that
word.
word.
All
Yeah.
about it. All about it.
So I guess more commonly though in young women is that painful sex side of things. And yeah, super important that there's more awareness around that. And I think with endometriosis as well, there's definitely a lot more conversation happening, a lot more awareness, and I guess a lot more knowledge as well about the role of pelvic physiotherapy, or that's what I hope.
Nice.
Yeah.
And like mechanism as to why endometriosis causes like the tightness with the pelvic floor, is that due to like the inflammatory response around
I think it's
uterus?
a multitude of things, and again, you could talk about this for a very long time.
Yeah.
But in terms of pelvic floor and endometriosis, when we have pain, and I think a nice way to describe it is when you hurt your back, for instance, you may have twisted a funny way, and then what happens is all of your muscles spasm to protect the area.
Yes.
So
An
very-
overprotective response
Yeah.
goes. Yeah.
Yep. So with endometriosis, it's usually because you have that tissue that's like the tissue lining your uterus outside of your uterus, and that creates an inflammatory response. Your body doesn't like it, so all of the surrounding muscles will go really tight and spasm as a protective, overprotective response, essentially.
That
Yeah.
makes sense.
So touched on this before as well, but just wanted to go into the risk factors, because although the most common ones are age and childbirth, they're not the only ones.
Yes.
So other things that we look at in terms of risk factors are your bowel habits. So I always love a bit of poo talk.
So is
Oh,
that
me too. I've gotten so much joy I was showing all my new clients the Bristol stool chart. I'm like, let me just bring out my little friend. And they're like, what? And I'm like, yeah. We're getting there.
Because Renee and I used to work together, and I'm pretty sure you printed one off and was laminating it or something. And we were in the office going, what?
So it's durable.
Yep.
You need it at all times.
You need
Exactly. Yes, I'm also a big fan
that
of the
and
Bristol Soldier.
perineal tears you were
Oh,
printing
yes.
out and
I have laminated a
laminated.
few questionable things over the times. That if you didn't know what I was laminating, it would look very
Very
concerning.
strange.
Yes. So in terms of poo talk or bowel habit, so the consistency of your stool, so Bristol stool chart, whether you're straining to open your bowel, so like we were talking about before, straining increases intra-abdominal pressure. And if you're straining every single day, that's pressure that you're putting on your pelvic floor every day.
So that's like a crazy heavy squat every single day. Like
Yeah.
it's not maintainable. Like
Yeah,
it's
yeah.
just, it wears down quicker than
Yeah,
it builds
exactly.
anything
And
up.
something's got to give, you know.
In my head, I'm like, are you comparing a heavy squat to straining to go to the
I
toilet?
mean, the effect on the muscle. I
She
nearly
is.
said bicep curl, and I should have just said that because it was more separate.
So it's a little bit
You
separated.
can't strain your muscles every day and expect them to be okay.
Exactly.
Was my point.
Yes, nice summary. So similar to that, chronic cough or allergies. So again, if you're sneezing, if you're
Yeah.
coughing multiple times per day, and putting that stress on your pelvic floor, your work, and if it involves heavy lifting. So again, if you're doing repetitive heavy lifting every day as part of your job, or also your hobbies. So exercise as well. If you are a heavy weightlifter and you're doing all this training and you're not actually able to, I guess, tune into your pelvic floor, or if you're not using your pelvic floor correctly, then again, that pressure over time, can create issues down the track. Yeah.
I had like a really bad cough like 3 years in a row, and it lasted months over each of the years. I remember towards the third year, I was like, this is not going well. This is not good. So finally I got rid of it, and it's been years since I've had that bad cough. But definitely the third year of bad coughing for months and months on end, I could definitely
notice
feel
the
the difference.
difference? Yeah.
Absolutely. Yeah,
I love
definitely.
this talk because it's often people be like, oh, there's an issue. It must be some sort of big like mechanical or physical problem, but it's like, where did it come from? Like the smallest things that go back, and it's like the tiniest habits like coughing.
Yeah.
Like it's just such a good perspective to have for even me thinking about my clients. So if they tell me they have issues with straining or incontinence,
Or
and
even
I
like
can,
hay fever and stuff, like if
Yeah.
you're sneezing all the
yeah,
time.
exactly.
So
Yeah.
I would never sit there and link hay fever to issues with pelvic floor and that. But that's
Yeah.
just so good.
And I guess the nice thing about it is if someone, comes in complaining of stress urinary incontinence, and they do have this history of hay fever, and, granted nothing else is going wrong, but
Yeah.
if you tell them, take medication, go to your GP.
It's worth,
It's such a simple fix. You
Yeah.
can really help someone just by changing something as small as that, where they had no idea it was contributing.
Yeah, and even if someone with stress or anxiety, you said like anxiety in the pelvic floor, like they could think they have reproductive issues and nervous system issues. But if you're like, hey, this might be because of that, if we fix that, it'll fix this.
Yes.
Like that's just such
Everything
a good
is
approach.
Yep,
always
same with pain as
interconnected.
well. We know that if you
Yeah.
can be more relaxed about it,
Yeah.
not so threatened by it. Then
Yeah, so
you'll be fine.
when I see women with chronic pelvic pain or pain with sex or overactive pelvic floor, a huge part of the treatment and the first route we go down is always stress and anxiety management every single
Yeah,
time.
yeah.
So lots of progressive muscle relaxation, mindfulness, body scanning techniques, and all that kind of stuff.
Nice. I often finish my Pilates class with 5 minutes on the floor, going through that kind of stuff.
Yeah.
You're
absolutely.
nice. I don't. I'm like, we got 5 minutes stand up. We're going roll downs into push ups.
We can fit in another ab set. Let's go. And I'm like, breathe in and melt into the floor. Exhale.
That's so nice. I should be more like you. For the sake of their pelvic floor.
I think you should. There
Yeah.
you go.
Wow.
Oh, okay. So, Kegels. What's the go with Kegels? And is that what we should be doing?
Kegels. So
I've been reading a lot of pregnancy blogs, and all they say is Kegels, do your Kegels. And
I
I'm
learned
like,
that word like only a few months ago. I was like, what? What is that?
so Kegels is the American word for pelvic floor exercises.
Yeah, cool.
Yeah.
I thought I figured something along the line because I knew what it was.
Yeah.
I love that it's like a known word. Like pelvic floor exercises is a known word.
Yeah. I feel like less maybe our generation. I feel like all our
Yes.
parents will know what Kegel exercises are.
Yeah, maybe.
Yeah,
Yeah, so,
I agree. Older
yeah.
generation generally call it Kegels.
Yeah.
Younger generation, pelvic floor exercises.
Yeah.
I don't think there's actually a difference between the two other than the name.
Yeah.
But I guess pelvic floor exercises, so that is the, I guess, routine lifting and relaxing of your pelvic floor to try and get some sort of outcome from it. So whether that be like a strength outcome or an endurance outcome, or even sometimes you can use those pelvic floor exercises to help with relaxation as well, but generally that comes down the track.
Okay.
Yeah.
Yep.
So that leads me to the next thing I wanted to go through, which is how do we lift our pelvic floor? How do we relax our pelvic floor? So just trying to start to increase your awareness of these muscles and what it feels like for them to turn on and what it feels like for them to turn off. This is going to be so helpful for Shelby.
Yeah, I'm sitting here like
I'm
trying
ready to
do
like
it
try
myself.
whatever you say.
Yes.
Everyone listening, male, female, give it a go. If you're sitting in your car, because it's good.
Yeah,
Anyway, I'm
yeah.
gonna continue letting
Yes.
you speak, but yeah, sitting is good.
Do
Yeah.
it with us if you're sitting in
Yeah.
your car. If
Yes.
you're walking. Do you have question? Do you have to be stationary?
No.
Aha.
Oh, again, another whole topic. The easiest position to do pelvic floor exercises or to increase your awareness of pelvic floor, I generally think is laying down because you're not working against gravity.
Yeah.
Sitting is a nice one as well when you're starting off. And then as we progress kind of any other exercise, pelvic floor is super similar. So you start, gravity eliminated, then start working against gravity, then start doing pelvic floor with movements.
Resistance as well.
And resistance. So as you get better at it and your awareness increases, you can start to do them when you're walking.
Yeah.
And then as you get even better, you can start to do them when you're doing your squats and when you're doing your Pilates exercises and all that kind of thing. But before we go into how to lift your pelvic floor, I just want to preface this with, it is just as important to be able to let go of your pelvic floor as it is to actually be able to turn it on.
Like I said at the beginning, this is years ago now, so I haven't had to check for ages, but I'm so good at turning it on. That baby will come on.
Shoot out.
But it was very hard to turn off again.
Yeah.
And that was, because we talked about this before, that was, you were kind of linking it to your experiences with ballet, like your ballet training.
Yeah,
like
yeah.
The pull up
Well,
and
actually, I remember because I think that's one of the main reasons they picked me, because they thought I would have a really good TA activation. And I did. I was able to, apparently, I don't know if this is, but anyway, we looked at my abs and I could just activate TA without anything else coming on, apparently. Yeah. So-
Yeah, so when we assess pelvic floor, we often assess how it co-contracts, I guess, with your TA muscle.
So they picked me because they knew I did ballet, and apparently ballet dancers are good at doing that. And then she part of it was down to pelvic floor. And
Yep.
that's where
And
it all
then it
fell
all
apart.
went downhill from there.
Yeah.
All right, so wherever you are right now, whether you're sitting in the car, sitting at home, going for a walk, you want to start off by being nice and relaxed. So you want your belly.
We are filming this episode, so if you're watching this on YouTube, you'll see us all go, okay, and relax.
Oh, that's classic. I
Go on.
completely forgot. I
So
can't pull a
relaxed.
concentration face now, like,
Okay, go on.
So nice and relaxed. Belly should be out. So we don't want any belly sucking in. So let yourself be bloated. Let it all go.
So easy.
And think about your sitting bones spreading apart. So if you are sitting down and you're not in the car, you can put a hand on your belly and a hand under your bottom. So the reason we do this is to make sure that you're not using your glutes or your outside tummy muscles instead of using your pelvic floor. So you shouldn't feel anything underneath either of those hands. So all of that should stay super relaxed. So starting by gently squeezing around your front passage and your back passage as if you were trying to hold in wee and wind at the same time.
My belly pulled in.
Yes, it's really, really hard. It's such a subtle contraction.
That's the thing, isn't it? It's subtle, because that's one of my biggest cues when I rarely do it, but when I do cue it, I'm like, it's subtle,
Yes.
tiny,
Yeah.
that's it.
Yeah.
Don't,
Such a good sound
because I
effect.
say, because I say sometimes, I don't know, but depending on the client, and I'm like, lift and then brace or whatever, and I see them like bear down. No, too much.
Yeah, slight detour, but also really important if you are a fitness instructor and you're prompting pelvic floor in your classes.
I was going to ask this at the end. Yeah.
The way that you use your voice is really important because I've heard a lot of Pilates instructors, especially before, be like, squeeze your pelvic floor. And that just gives you the complete wrong idea because you're going to squeeze your butt as hard as you can and nothing good is going on.
I heard this maybe from you, but and so when I say, I'm like, and lift and wrap and I'm like,
gentle voice to prompt like gentle squeeze and lift.
I've been using lately like a T analogy, like the stem of the T from your pubic bone to your belly button. Like think about tracing your finger from the base of the T towards your belly button.
Like up pubic bone to belly button.
That little bit of a lift and then TA with the the top end of the stem.
Wrapping around as well. Because, sorry, I know we're sidetracked from actually trying to lift your pelvic floor. Other one I've heard is an elevator. Was that?
So there's so many different cues of pelvic floor.
Yeah, just like lifting the elevator up to like
one level.
Yeah, exactly. So it's little.
Oh, that's nice.
Yes. Other ones that I've heard are trying to suck a blueberry up your vagina.
Yeah, I don't like that one. I've heard that one. I can't deal with stuff like that. There's no way I'm saying that ever.
I think everyone would just have a giggle.
I feel like that makes it violent. So if I'm thinking about that, I'm like, whoa, we're up. We're in there.
Even spread your sit bones, or I can't say that ever. It's not my cue to use. I go bright red. I can't do it.
Spread them.
But anyway.
But I think the best one to start off with, if you haven't done this before, is that squeeze around your front passage, squeeze around your back passage, and as well as squeezing, you want to get that lift as well. So squeeze and lift, front passage, back passage. So very subtle feeling.
I
know.
Then you're probably doing it wrong.
I know, exactly.
Don't try as hard.
No, as in I'm focusing, I'm concentrating.
I almost explain it as like a little flutter.
Yeah, okay.
Yeah. All right, so let's
okay.
Yeah.
That worked. I was going too much.
Yeah, it was too. I didn't think I was, but that was.
Yep.
All right, let's start again. All right. Relaxing. Tummies are out. Bottom is relaxed. They're going to gently squeeze around your front passage and back passage, drawing them up inside of you. You want to keep holding this as you breathe, so no breath holding. Good. Keep breathing for 5, 4, 3, 2, and 1. And then you want to relax these muscles right back to their starting point. All the way back down.
That feels like
I don't think I can relax mine either.
Yes. I'm probably the exact same I was years ago.
Yep, I'm the same. I can lift forever, but letting go, I don't know what it should feel like.
Feeling that let go, I can't
even
feel
letting go of my belly, like the let go, I'm like, this feels weird because I'm so used to like standing up straight and whatever, and that's weird. I'm like, ugh.
It's my favourite thing at the moment, letting my belly hang out. It's so comfortable.
Oh, I know. Have a big lunch, pregnant? Who knows? We know now.
Either way. Anyway. Yeah, all right. So with that, I've always heard real-time ultrasound is one of the best like biofeedback ways of learning this properly.
So with real-time ultrasound, it can be really great for the person that you're working with because they can see it. Because when you do real-time ultrasound, you have a look at the bladder and you can see the bladder neck, and then the bladder neck changes depending on if you're lifting or relaxing.
Yeah.
So the great thing about that is that the person who is doing it can see.
Yeah.
But
so
they're...
Then you can tie what you're seeing with what you're feeling.
Yeah.
And that can help that learning process.
Exactly, and it can be really helpful. But there are some limitations to real-time ultrasound, which is what leads us into doing an internal examination, like we were talking about before. So what real-time ultrasound doesn't tell us is it doesn't tell us about pain. It doesn't tell us if there is any prolapse going on.
Okay.
And it doesn't tell you the power of the muscles. So you can see whether the muscles are going up and down, but you can't tell the actual strength. So in physio, we measure strength out of 5. So 0 would be the muscle isn't turning on at all, and 5 would be that it's super, super, super strong.
Yeah.
And you can't get an idea of that either on real-time ultrasound. So and generally most cases we will need that extra amount of information. And so an internal examination is kind of the gold standard to gain that side of things.
Yeah, absolutely.
And this is, I've just thought of a topic for another episode. Like if your muscle's tight is it weak or strong?
Yes.
Right, because I've heard that. Like, you correlate tightness with strength, like it's contracted, like it's holding, but not necessarily. And that's something
because
I've
then
learned
you
too.
run into overactive, like tired, like, and it's fatigued, and then it can't work properly.
And is
under
that why it's tight?
Yeah.
I do love this topic.
Like this overprotective, like I'm not strong, so I'm going to give it everything I have all the time because I don't have the strength to like be chill about this. So I'm just all the time going, just hope for the best because I know I don't have that base strength to do that with.
Just to briefly touch on that though, you can have overactive pelvic floor that are weak for
yes,
sure.
absolutely.
So just because they're on all the time doesn't mean that they're strong.
Yeah.
And you can even get dysfunction from the fact that they're fatigued. So you can imagine if your muscle is on all the time, then if you cough or if you sneeze and it needs to turn on even more, it's going to be fatigued and that's going to be really difficult.
Mm-hmm.
Yeah.
Yeah.
So can it be overactive and not weak?
Yes.
Okay. Cool.
Yeah.
All right.
So it can go either way.
Yeah. Good.
Yeah.
I love this topic too.
Because used to it was always like underactive pelvic floor, like it's not working enough, that's why you're leaking. And now it's kind of, from what I understand, shifting to probably a lot of us are stressed and overactive, and they're not able to deal with those fluctuations in pressure the way we need to.
Yeah, exactly. So that pelvic floor exercise that we did before, that's more focusing on the endurance side of things. So like the way that we train the other muscles in our body, we can work them for endurance. So the way I explain this is with your leg muscles, for example. If you're a long distance runner, you're training those muscle fibers for endurance, right?
So we did how many reps should I do recently, and then will cardio kill my strength gains just recently. And
we talked about that.
Yeah.
Or I guess the other side of things, you can train those muscles more for strength. So again, heavy squats or big jumps, things like that. Pelvic floor are the same. So we can work them for endurance. So that's kind of your really gentle hold for as long as you can. And then the other side of things is training it more for strength. So that is lifting as hard as you can, but not holding. So that's more of a pulse.
Yeah, okay.
Why don't we try this one?
Okay. Oh, no.
Yeah.
Again, it's going to go on and it's not going to flicker.
And it is harder to relax with these ones as well because you have less time to do it, but it's worth trying. See how you go.
I do this with people's glutes all the time, actually. I want them to turn on them and turn off. And so I will routinely do that in a Pilates class, like each side and like together, and so they can really get the on-off. And I know people struggle with that.
Yeah.
So I can't imagine when it's less palpable.
Yeah,
how
even
bad
harder.
it's
So we always start with relaxing. So relax your belly and your bottom. So we're thinking about squeezing and lifting the muscles around our front and back passage as strong as you can. So squeezing up and letting go. So we're remembering not to squeeze our butt cheeks, not to suck our belly in. Try not to hold your breath. So we're going to do 4 more. So squeeze and let go. Squeeze and let go. Squeeze and let go. And last one, squeeze and let go. So a lot faster, but a lot harder to relax in between.
So I have my hand like really low on my belly, like between my hip bones kind of thing.
Yep.
Like thumbs on pinky finger, thumbs on belly button, and then my pinky finger lies down. And I can feel flickerings under like my pinky finger. Should that be there?
Yes, that's fine.
That's okay. Yeah,
that is probably your TA turning on, which we do want to turn on with your pelvic floor muscles.
Yeah.
It's more those your six-pack muscles that you don't want turning on, or that sucking in of your belly button towards your spine. That's what we
but like low down, I can kind of feel like a flickering.
Yeah, that's probably a good thing.
Cool. Oh, good. Oh,
Yeah.
guys. Oh, I'm working. I'm
Well,
losing.
I have a question.
Yes.
So, does activation, can that be affected by the position of your pelvis too? I'm just thinking some people sometimes sit slouched and they're like have flexion going on. Like think about scooping your butt under and clenching your butt cheeks type
Like a
vibe.
posterior pelvic tilt versus anterior pelvic tilt.
Or you can tilt forward with that like lumbar spine arch. Can that affect the way you activate?
That's a good question. I've not really thought about it much before, but I guess taking into account where your pelvic floor muscles are attached, if you're in more of a posterior tilt, I would assume that your tailbone is coming closer to your pubic bone.
Yeah.
Yes.
Yeah, so if that length is shorter, I don't know whether it would be harder or easier.
I find it harder tucking back. If I'm sitting up, I'm arching my butt out, I can feel it a bit easier than if I slouch under.
Agreed, because of my scoliosis, I have no
extension.
kind of arch
Yeah.
in my lower spine. I'm very flat or if anything tucked under. And I was just thinking to myself, when I arch into like a usual neutral spine that normal people have, but I don't, I feel like I can activate it better.
Yeah.
So I actually think that's probably the opposite
Yeah.
of what would be
Really?
normal. So when I do my
I'm trying so hard to think right now.
when I do my Pilates classes, I normally will often start off with like a pelvic tilt.
Yes,
And
yeah,
so I
absolutely.
will always prompt an inhale with an anterior tilt and an
Yes.
exhale with
I
a
do the same
posterior
thing.
tilt.
I hadn't even considered. Yeah.
And you always want to lift your pelvic floor on the exhale because they
Yes.
That
naturally
makes
go
so
up
much
anyway
sense.
on
That's
the
what
exhale.
I do too, but I hadn't considered that with the pelvic position.
Yeah, so I guess like we were saying before, tailbone comes closer to pubic bone as you tuck and then further away as you lengthen. And I guess the longer the muscle, the harder it would be
To contract.
because that length tension relationship
Yeah, I'm
is...
just bringing up a photo because I'm. Oh, like where it is. As if you're tucked under. Curious. Yeah, curious.
Hmm.
Cool. But yes, definitely the breath work is really interesting.
Yeah.
And then
Yeah.
you can use that in your exercise and in your lifts.
Yeah, and
So,
that's
yeah.
something that if you ever work with a pelvic floor physio, they will prompt you on because it is a lot easier to lift your pelvic floor when you
When you
exhale.
exhale.
Because it naturally happens. Your pelvic floor and your diaphragm work together.
Mhm.
So when you breathe out and your diaphragm goes up, your pelvic floor also go up. And then when you inhale, diaphragm goes down and pelvic floor also go down.
Yes,
So
they
when
move
people,
together.
they move together like
Now-
that cylinder to maintain it.
That interests me because I'm just thinking about relationship to gym work. Like if you're doing a squat, you want to lift up as you go down essentially?
Yes. No.
No, I would kind of like, I would do the same thing. I'd inhale on the way down.
Yeah.
Then when the power is on
When
the
you have to
swaying-
brace
standing
and
up,
stand up.
that's when I would exhale and that's when I would lift on the way up.
Yes.
It is hard to get your mind around it.
Okay, so like pulling up as you press up, like contraction, lift up to standing.
Yeah, because you need to
okay.
lift with the effort and you exhale with the effort.
Yeah.
So the hardest part where you're more likely to
Yes,
push
the
out,
hardest part.
Yeah,
That's when you want to
that's
lift.
when you would
Yes.
exhale as well. That's a pretty good
Yes.
cue, and that's when you'd want to lift.
Yeah,
Yeah.
yeah, exactly. And
That makes sense.
Yeah, that reminds me as well. Breath work can be really useful in pelvic floor that can't relax because when you inhale, and if you inhale properly, like a deep belly breath, you automatically relax your pelvic floor. Where if you're overactive or not, you have no choice in it. So if you did the exercises before and you were finding like you had a lot of trouble letting go, do a really big belly inhale and see if you can feel that any easier.
With like those 30 centimeter inflatable balls that you can get, like in Pilates, with the orange ones.
Yeah.
If you like perch on that, like you're hatching an egg.
I've done that before.
Yeah, or this is where your hands come in, like you can kind of kneel and have your hands underneath.
Yep.
And I've done this with people before who I know are just gripping the
Yeah.
life out of their pelvic floor. And exactly breathe, and then that feedback of that thing underneath you can help you like.
Yeah, so that increased pressure or that where your perineum is. So the perineum is the area between your vagina and your anus.
Yes.
That area can kind of sink down more into the ball as your pelvic floor relaxes, and that kind of feedback can be really nice.
Yeah.
Yeah.
It's a nice one.
I'm just, my brain's thinking like I'm like my
I
body,
know
my
you're
muscle, where
connecting
would the ball
dots
be? Yeah.
That's where you go see Renee, and she can show you where to put it.
Yeah.
And show you exactly how to do that.
Yeah.
I love that exercise, and it's such a comfortable position, and it just feels so like weightless. It's beautiful.
Yeah, it's
So
really nice. And I like doing that with my pregnant ladies as well.
Yeah.
So I think we've all realised pelvic floor is a little harder than we initially thought.
It's much bigger topic than you would think initially.
Yeah. So if you want to go and do any pelvic floor exercises, or you're, thinking now, how can I include this in my gym work or my Pilates work? I would really recommend that you see a pelvic health physiotherapist.
Renee, go see Renee.
Yes, please. I would love to see you before you go and do that, because, you see it really often that women will come in and she's like, yep, I know how to use my pelvic floor, and you check it out and she's actually pushing down rather than lifting up. So you want to make sure that you're doing it right.
Yeah.
Get checks before you start doing anything.
Absolutely. So on that, how can we come see you if someone's listening is interested, or me I'm going to come see you.
I'm thinking in my head, I'm like, I want to come see you.
Yes,
Yes.
everybody
No.
come and see me. I love to chat about this stuff.
Yes.
So you can find me at Dinella Family Medical Centre. So I work out of there as the physiotherapist in the GP clinic. So you can
Nice.
give them a call, book in to see me. I would love to see you guys.
So you've got all the Pilates equipment, you've got all your physio equipment there. It's all kind of kitted out quite nicely, isn't it?
Yeah,
So
so
cool.
we've got a reformer, we've got a Cadillac, so we can do all that Pilates side of things if that's what you enjoy. We've got weights in there too. I always love a little bit of resistance work. I think it's really important as well if you're loading in your everyday life to kind of recreate that in the clinic.
Exactly. A really nice
Yeah.
place to practice.
Yeah.
Yeah. And we've got the real-time ultrasound there as well, so that'll really help.
Excellent.
Yeah.
Amazing.
That's what I want to do. I want to do the ultrasound.
Yeah.
And it's like see
See
it all
it?
contract.
Yeah.
Oh,
Yeah,
so
yeah.
cool.
You can find my baby and have a look at it.
Yes.
Do you have, so yeah, like do you do ultrasound on pregnant ladies, obviously for pelvic floor,
Yes.
which is down lower than baby is?
Yes.
But do you ever go like, oh, and have a little look up?
Sometimes I'll normally find the baby before I find the bladder.
Yeah,
For sure.
Amazing. Yeah.
Imagine
Even
if you accidentally.
Yeah, would you
You're
have
like,
found
"Whoa,
a
there's a
pregnancy?
baby."
That has never happened to me, and I have thought about that before.
Yeah.
But if I wasn't looking for it, I don't think I,
know.
would
My
find it that
6-week
early on.
scan, you could see something was going on that wasn't
Yeah.
there. Yeah, yeah.
You showed me that, didn't you?
Yeah, it's like a little
tiny
jelly bean.
pig,
But
yeah.
you'd see it there that it wasn't supposed to be there.
Yeah, and obviously I don't know how to look for babies, so I don't think I would have a good chance.
Like, what is this?
That's not your prime goal there. You're not like, let's check
Yeah.
to see if they're pregnant. You're just looking at pelvic floor.
Yeah.
Perfect. Amazing. So I'll have all the details in our show notes or whatever they're called.
Yeah.
And if you want to contact Renee and can't, go through us. So turnsounds@gmail.com. You can email us, or our Instagram is moveyourmind.podcast.
Mm-hmm.
Message us, or do you have any socials you would like to plug where people can find you?
I have my personal Instagram, so
Yeah.
you can contact me on that if you would like.
Yep.
I don't have much women's health stuff on that at the moment, but I
It's
don't
just
mind.
a
Come on
fun
over
Renee,
anyway. And that's at Najaz, so Naejaz.
Nice. Cool.
Yeah.
Lovely. Watch you get all these random
Yeah.
messages.
Yeah.
I pee when I jump. Please help
I
me.
will love it. Don't worry. Send me all the messages.
That was
Really?
me on my Instagram with nutrition questions. Like someone's like, I can't poo, and I'm like, oh, tell me more. Tell me more.
Brilliant. Thank you so
Yeah,
much for
thank
joining,
you.
Renee.
Oh, you're welcome.
Did you
I've
cover
loved it.
everything you wanted to in this initial episode?
Yes, I think so. I was saying to the girls before I could talk about pelvic floor for about 5 hours non-stop,
Yeah.
so I had to rein myself in.
Yeah. I'd be pretty happy to have you back.
Oh,
we
yeah,
can do
definitely.
our like endometriosis, PCOS type
Yes.
stuff
Oh
as
my God,
well.
yes.
We can
Yeah, for
talk
sure.
exercise as well. If any of you are experiencing things and you want to ask a bit more of a specific question, like I don't want to squat heavy because it feels too like it's going to fall out or anything, we could have a little discussion on that here as well.
Yeah,
Obviously,
for
best
sure.
to get tailored treatment. That's
Yeah.
what we always say as well, but we can give
Completely.
general advice.
Yeah.
So
And just
happy to-
awareness. That's
yeah.
what I love. Just awareness. Like,
Tell your friends.
Yes.
Yeah. And I would actually like to go into male pelvic health as well.
Yes.
Dive a bit more into that, what that looks like.
Yes, me too, once I learn a little bit more.
Brilliant. All right, tell us when
Yeah.
you learn that and we'll have you back.
Males
on.
are a little bit foreign to me at the moment, but as soon as I learn a bit more.
Brilliant. We'll have you back on to talk about that
Yeah.
as well. Brilliant. Thanks
Catch
so
you
much.
next
Thank you,
episode.
guys.